This second part of the video series on research study design plan that I'm doing for you to assist you completing your assignment, we're going to go through the first week's plan of what you need to do, and that is to develop a research question, which seems pretty easy, but there are a few steps in needing to do this. Okay, so bear with me and we'll work through this. If you haven't already seen, on the left hand side of your Interact site, I've got in the learning content area, I've got the research study design plan help, and there's a video there that goes over the assignment to start with, so go and check in there. Here's the table. Now what I've done is I've taken the liberty of copying the table into a Word document so you can see it here. Now I've also started a Word document here about how we're going to work out what subject we're going to do and how we're going to do that. I'll just increase this so it takes up more of the room in the screen cast-o-matic. Okay, so I'm going to think about some things I'm interested in. Now, it may be that you've had a recent clinical experience and there was something you saw and you identified this problem. And that could be the basis of your question. So it might be something like, what is the experience of people with dementia who maybe with early stage dementia? Who fall and break a bone, for example. Now that's pretty lay language here, so we're just talking about pretty lay language. So we can work that up because we've seen this in our clinical. But it might be you don't have anything that developed. So you've got to think about a topic you might be interested in. And you might think, well, I was interested in understanding how patients slept when I was on clinical or on workplace learning. And what am I interested in about their sleep? Am I interested in how they sleep, how the nurses sleep, that kind of thing? So maybe I'm interested in both patients and carers. But what if recently I've been on a maternity placement and I saw some pretty stressful things happen? I might start wondering how the midwives sleep after a stressful shift. So I might start wondering about that. One of the things with that is that we're now starting, as you can see, rather than having up here where we had our question, we saw something happen, we pretty quickly were able to develop a question. Now that might be a few of you, but most of you won't immediately have a question that you can think of in your head. So we will need to go through this sort of drilling down to try and get something that you're interested in. Now you might just work it out on a bit of paper, or you might do a little bit of a brainstorm on a bit of blank paper, or you might go and find some concept mapping software on the internet where you might go and have a look at mind maps. You might go and have a look in one of these and start creating a mind map. Okay, so that's up to you how you want to work with this. I'm just going to show you here. So you might have been, and we'll put in that next step here, maternity ward, or you might have been either on placement or visiting someone you know who had a baby. It doesn't matter where you get your ideas from. So we've sort of got a general topic area here now, don't we? How do midwives sleep after a stressful shift? So that's not really a question, is it? So more, this is really our topic. So let's drill down a bit more there. What sort of things would cause them to have a stressful shift? Well, I suppose we can go in and have a look here, can't we? Let's go and have a look at, actually we'll go in here and we'll go midwives. Now I'm on Google Scholar. Midwives stress. So you can see here that experience of stress experienced by different sorts of. Alright, let's go and have a look here. So this is where we're going to start. We're going to start by drilling down and having a look at some of these. Now this is an old paper, this is from 98, but we're going to start getting some ideas here. Okay, so it's an exploratory study. They're actually looking at what sort of stresses that midwives have on their wards. So we're going to look down here and towards the end, and we're going to see what sorts of stresses they had. There was professional sorts of stresses, occupational stress, stress in the workplace, and personal stress. What about if we were interested in the sort of professional stress, like perhaps preterm labour, that sort of thing? That's something we could be interested in. Similarly down here, there's a nice paper here on factors that may influence work-related stress and burnout. So what do they say? They talk about let's just pop down to the discussion. Let's have a look here. So there's a few reasons that these found some stress. Now they use some interesting measures here, so we can start thinking about this as we're going to keep looking at oh, that looks nice there, doesn't it? It's these are really some good ideas. So what are the sort of describes sleep stress and compensatory behaviours in nurses and midwives? So that's really interesting that we found sleep problems, high levels of stress and exhaustion, low job satisfaction are prevalent amongst nurses and midwives. Now this is not exactly what we're looking for, is it? Because what we were sort of wondering is, we might have thought about, we were sort of talking about preterm labour and whether the midwife might worry about the outcome of the baby in a preterm. And for many different hospitals, they tend to use a particular algorithm that says if a baby's born here, they get referred. If a baby's born there, if they're not in tertiary level centres. So we've had a look at the research, a little bit at the research, and you're going to need to look at a lot more than what we did here, but I've only got a short video space to do it in. And again, more, even though they're old, this is 1994 one, we'll look at it. We may not reference it, but we'll look at it okay, to get some ideas, to you know, are we looking at, are we interested in, say, that other article we were just looking at? It was looking at compensatory behaviours. Well, are we interested in the compensatory behaviours? Not really. I think I'm interested in the experience. So maybe I might start drilling down, and I might come up with 4 or 5 questions before I feel like I've got the right one for me to answer right now. So I might decide, what is the experience of 4 midwives in delivering a preterm and, oh, bad spelling, folks, preterm baby. And we might, just so that we have a good understanding of this, we need to define this. So we're going to put that at less than 35 weeks, because they may have an adverse outcome. And we might start playing around with that. So there's a question. We might then go on and say, what is the experience of stress? No, that doesn't quite work. So you'll find quite a lot of this as well. So what is the experience for midwives in delivering a preterm baby? Here's another question we might get from this. What sleep effects do midwives, we might need an I in there, encounter after a stressful shift? And we might go on to drill that down a bit, where we after delivering a weak baby. We may go on to do a similar question, but because this baby would need a referral out of a lower level hospital, a 26-week baby. We might go on to say gestation, or, you know, getting that kind of thing. Now, there are videos on Pico that you can go and have a look at. I particularly like this question here, and I think that that's the question that I want to answer. What is the experience for midwives delivering a preterm baby? So that's the question that I might work on for my research study plan.